Have you ever wondered why a simple cough can turn uncontrollable? Or why certain times of the year it feels like everyone around you gets sick at this exact same moment? What if I told you that one of the world's most common illnesses is also a master of evolution, changing its identity every single year to evade our best defense?
Assalamualaikum warahmatullahi wabarakatuh. My name is MOHAMAD ASYRAF by AZMI. Will be explaining about influenza viral disease for my individual virology assignment.
Before we go further for the topics, let's see the overview of the influenza diseases.
Influenza or the flu is a highly contagious viral infection that affects the respiratory system, mainly the nose, throat, and lungs. Every year, it spreads rapidly across communities, especially during the colder months. The virus travels easily from person to person through tiny droplets released when an infected individual cough, sneeze, or even talk. Because of this quick transmission, influenza remains one of the most common respiratory illnesses worldwide. Influenza is caused by influenza virus, not the bacteria. The two main types responsible for seasonal outbreak are influenza A and influenza B. These viruses constantly change through mutation, which is why new strains appear each year and why the annual vaccination is recommended. Influenza A is known for causing larger outbreaks and pandemics, while influenza B typically leads to seasonal epidemic. A third type, which is influenza C, causes only mild respiratory illnesses and is not associated with widespread outbreak. The most healthy individual recover within 1 to 2 weeks. Influenza can lead to serious complications such as pneumonia, respiratory failure, or worsening of chronic medical conditions. These complications are especially dangerous for vulnerable groups such as young children, older adults, pregnant women, and people with weakened immune system.
Next, we're gonna talk about the causes and transmission.
The flu mainly spread through respiratory droplets. When an infected person coughs, sneezes, or speaks, droplet carrying the virus can enter the mouth, nose, or eyes of someone nearby. Indirect transmission can also occur when a person touches a contaminated surface like a door handles, phone, tablets, and then touch their face without washing their hands. Some influenza A viruses can also spread from animal to human, especially from birds. These zoonotic transmissions are rare, but they can lead to new strains capable of infecting humans.
So now let's see the symptoms and clinical feature for influenza viral disease.
So now, what is the symptoms and the clinical feature for the influenza virus? Influenza disease. Influenza symptoms often begin suddenly. A high fever, usually above 38 degrees Celsius, is one of the most earliest signs and often accompanied by chills. Other common symptoms include a persistent cough, sore throat, runny or stuffy nose, headache, muscle ache, or overwhelming fatigue. Many individuals feel extremely tired even after their fever has improved. In children, nausea, vomiting, and diarrhea may also can occur. While most symptoms improve within a week, some people may feel weak for longer, especially if the infection is more severe.
Let's see who the risk factors.
Certain individuals are at high risk of catching influenza, or developing severe complication. High-risk group include adult aged 65 or above, children under 5, pregnant women, people living in crowded environment, smokers whose their areas are more easily damaged. Medical risk factors include the weakened immune system, chronic lung or heart disease, asthma, diabetes, kidney or liver disorder, neurological condition patients, and severe obesity. Individuals with cancer or HIV or AIDS are also more vulnerable due to their reduced immunity.
So now we're gonna talk about the preventions and control strategies.
The most effective way to prevent the influenza is through the annual vaccination, which is updated each year to match the circulating strains. Good hygiene practice plays a major role. Washing hands regularly with soap and water to help remove the virus from contaminated surface. Avoid touching your eyes, nose, and mouth, and cover cough or sneeze with a tissue or your elbow. If you are sick, stay home until at least 24 hours after your fever has gone without medication. Rest, drink plenty of fluid, and use medication like paracetamol or ibuprofen to relieve fever and ache. People at higher risk or those with severe symptoms should seek the medical care. Antiviral medication such as oseltamivir, Tamiflu can reduce illness severely when taken within the first 48 hours. So our video has come to the end. To conclude this influenza disease, I want to give you a message of hope, which is influenza is common, but with awareness and simple preventive actions, its impact can be greatly reduced. By staying informed, getting vaccinated yearly, practicing a good hygiene, and caring for one another, we can protect our families and communities. With responsibility and cooperation, we can break the chains of transmission to create a happier future for everyone. Thank you.
Don't forget to like and subscribe my YouTube channel, and this is the reference that I use for my video. Thank you for watching. We see you next time.
Bye.